Hello again, students. Dr. Mobolanle Balogun here again, Senior Lecturer, Department of Community Health and Primary Care, College of Medicine, University of Lagos, and Consultant Public Health Physician, Lagos University Teaching Hospital. You're welcome. By now you have been taken through the topic of the care of the newborn in the health facility. Now we're going to look at the care of the newborn in the community. And there's some learning objectives for this session. It is hoped that by the completion of this session, you should all be able to understand the infection prevention and control measures required in newborn care at the community level. By way of introduction, the risk of newborn deaths is greatest during the first week after birth. We've already, mentioned again and again why newborn babies are more likely to have infections than older children. Infections are probably one of the biggest cause of newborn deaths in the community. Many of these newborn deaths can be prevented by simple interventions delivered at the community level. Home visits by community health workers have been shown by literature, when community health workers visit women in pregnancy and in the first week after birth, and even beyond that, can help to minimize newborn deaths. The CHOs have a very important role in the community that cannot be overemphasized. They can help to identify pregnant women in the community, to enable them to pay targeted visits during pregnancy and in the early neonatal period. It is essential that we visit every pregnant woman and register her on the pregnant woman's registry form so that we keep an update on her progress. We can make 2 targeted antenatal visits to all pregnant women in the community as follows. The first visit can be as early in pregnancy as possible, that is within the first 3 months of pregnancy. The second visit can be during the 7th to 9th month of pregnancy. We can help the pregnant women to also organize their delivery plan for their delivery, and then make postnatal visits. Either they come into the health facility or the community health officer visiting them at home, or both. So regarding the first visits, which I mentioned should be within the first 3 months of pregnancy, as early as possible in pregnancy, we should encourage all pregnant women that we've identified in the community during these visits to go for antenatal care, register in antenatal care at the health facility. There's some simple health screenings that we can do. As a minimum, we can screen for danger signs in pregnancy. A woman having severe headache, blurred vision is a danger sign in pregnancy. A pregnant woman who has swollen hands and face is a danger sign of pregnancy. If she has, she complains that she cannot feel her fetal movement, that it's been a couple of days since she felt fetal movement that she could feel before, it's also a danger sign of pregnancy. So these are some examples of things that we can screen for when we visit the women so that they can promptly be referred for care. We can distribute long-lasting insecticide-treated bed nets, which help to prevent against malaria in pregnancy, which is a killer of both the mother as well as the newborn. And then we should provide health education and counseling. And what do we talk about? We must stress the importance of antenatal care. We must stress, the danger signs in pregnancy. Let a woman know when she should seek help or call up for help or go to the health facility as soon as possible. And then we can also talk about HIV. We know that there are simple things that can be done. She can do a test, HIV test, to know her HIV status early enough in pregnancy, so that she can be commenced on antiretroviral therapy to prevent maternal to child transmission of HIV. So we can see in this picture some simple things that can be done with simple instruments, even in the facility. So monitoring the development of the pregnancy and the fetus, monitoring the health state of the mother and also the baby in the womb. Simple things can be done in the community. During the second visit, that is between 7th to the 9th month of pregnancy, we need to conduct health screening again. We can still check for malnutrition in pregnancy, take the weight of the mother, check her blood pressure, conduct, simple questions to assess if she has danger signs in pregnancy, check for pallor to have an indication of if she has anemia in pregnancy. Okay, and then we complete a birth plan with the mother at that stage. We must not assume that every woman who has been on antenatal care is going to deliver at the health facility. If you look at the National Demographic Health Survey for Nigeria, we have a higher proportion of women who attend antenatal care in orthodox facility compared to those who actually deliver. So visits at that later stage in pregnancy is a good time to prepare a birth plan with the mother, remind her of the need for her to deliver at the health facility, okay? Encourage preparation just in case of emergency. They can put money aside just in case for emergency. They can identify people that would maybe need to volunteer their blood for donation. Okay, they need to identify transport to the health facility so that all delays will be eliminated. So as much as possible, we need to engage in those communication with them at that late stage of pregnancy. We mustn't forget to give them health education on safe delivery and immediate newborn care. Okay, the mother, the caregivers have an essential role in the care of the newborn, and we must tell them even things like breastfeeding, preparing them for breastfeeding, teaching them how to prepare their breast for breastfeeding when the baby comes, teaching them about adequate latching, breastfeeding on demand, and avoiding mixed feeding. They are all important things that we can do at that second visit. And then care of the mother and the newborn at home is also very vital. Okay, we need to take care of the mother, ensure that they have our trust right from the womb, provide care for the newborn through all these activities that we have said, so that subsequent visits we are always welcome again. In helping her to organize delivery and help with delivery, she's going to deliver at a health facility, which we encourage strongly with a skilled birth attendant, recommend that someone be with her. It could be a trusted family member, it could be a community health worker, to help her. Okay, she needs to also prepare for the people that will help the children at home. And if present at the delivery, the community health care worker should care for the baby, record information on the delivery of the baby, and breastfeeding information on the delivery form. Now, the mother has delivered, we still need to make postnatal visits at the health facility or at home. at the health facility, encouraging the mother to come for her postnatal visit, or if she finds it difficult to, for cultural reasons, socioeconomic reasons, whatever reasons, we can also visit at home. And by all means, we can even do two, having her visit the health facility and then subsequently having a visit with her at home. This should be for mothers and babies, regardless of where they're delivered. So, for example, a woman who chose to deliver at the TBA should not be excluded from postnatal visits. In fact, they might need it even more. So we conduct at least 3 home visits for the mother and the normal newborn baby on days 1, 3, and 7. Because like we said earlier, the first week is the time when most babies are at risk of death. Even though infections are responsible for newborn deaths like later on, because they're more at risk of having infections at home from days 8 to 28. That first week is a point in time when we can also counsel them on how to prevent infections in the baby. And you're going to have another lecture that will take you through how to counsel mothers and caregivers on newborn infection prevention at home. And if there's a need to have an additional visit, if a newborn is at high risk, that is also indicated. A newborn that is at high risk, for example, is one that is born prematurely. Premature babies have an even lower immune system than full-term babies and are at even higher risk of newborn infections. So newborn care is very vital during these postnatal visits. The mother is there, and now you also have the newborn baby. For babies that were not weighed at birth, you can weigh them, use the opportunity to weigh them on day 1. Okay? It's important to weigh babies and monitor their weight, because after they are born, some of them, in fact a lot of them, lose a little bit of weight because they are born with extra fluid. So by the time they lose the fluid, we can see a slight drop in their weight, which should not be more than 10% of their weight. Okay? And monitoring them, by the time they are 2 weeks to a month, their weight should not be below their birth weight. So that is very vital, and it's something that can be done as well in the community. We can also check the temperature of the newborn. The normal range is 36.5 to 37.5 degrees Celsius. So anything that is too high or too low is a problem, okay, and a possible cause of referral for further evaluation. We need to observe breastfeeding practices and assist as needed. Is the baby feeding? Is the mother breastfeeding on demand? Is the baby able to latch on? Is there a problem with the baby's suckling reflex? Okay, all of these we need to evaluate and assist and refer as needed when problems are identified. We need to also perform cord care and eye care. Cord care will be discussed in more detail when we are looking at the other aspects of care for the newborn, okay, and eye care as well. We need to count the newborn respiration, which should be between 40 to 60 beats per minute. If it is higher than that, okay, that means that the baby needs to be referred urgently, and we need to screen for danger signs in the newborn. Some of these danger signs include poor feeding by the baby, a low temperature or high temperature, very high respiratory rates, difficulty in breathing, a baby that doesn't respond to stimulus. Those are some examples of these danger signs in the newborn. If any sign of sepsis is present, we need to refer immediately, but advise and ensure on the care of the baby during transportation to the health facility. So these are some tips on ways to prevent newborn infections in the community. Good hygiene is very, very important. It is thought that good hygiene can reduce diarrhea by about 40%, and that is essential not just for the baby but for all members of the house, because if all household members are safe and free from infection, there is less of a chance of them passing on infection to the newborn. Safe water and sanitation is also important, ensuring that we have safe toilets, we have good clean water, okay, for use for the baby and for the household. Safe food preparation and good nutrition is also important for all household members. If everyone in the household has a good immune system, okay, and less incidence of infection, then we have less chance of spread of infections to the newborn. For the newborn, breastfeeding is key. Breastfeeding alone for 6 months is what is recommended, except if it is medically contraindicated. Breastfeeding reduces diarrhea by up to 50% and reduces respiratory infections by up to 30%, and is the #1 form of immunization from infections. It is cheap, it is natural, it is convenient. In fact, immunizations too are very important, and we must follow immunizations from birth and continue following the National Program on Immunization schedule right from when they are born to the completion of the schedule. Earlier, I mentioned cord care. Now, I'll give you some more details about cord care. The newly cut umbilical cord can be a pathway for germs that cause newborn infection and death to gain access to the newborn. Cord care practices in the community commonly involve the application of a wide range of substances. People use all manners of things. They use, cow dung, they use rags, they use heat, all forms of compress, herbs, all in the desire to get the cord to heal and to break off. Some do these practices to ward off evil spirits. So there are all kinds of things, and we need to know that, so that when we go into the community, we can counsel and educate these women about proper cord care. The desire to promote healing and hasten cord separation are some of the reasons why they do these things. Topical application of chlorhexidine to the newborn's cord has been shown to prevent infection. So, how do we apply chlorhexidine? When the baby is born in the health facility, usually the healthcare worker would help in the application then. When they are discharged, the mother is given a tube as well as part of the things to take home. So when she gets home, she needs to wash her hands very well with soap and running water and apply the gel to the stump of the umbilicus and the surrounding area using her index finger. After applying the gel, she puts nothing else on the cord and keeps the cord clean and dry. She's supposed to continue with this practice of applying chlorhexidine gel till the cord stump falls off. One thing that you need to note is that sometimes there is a 1 to 2 day delay in the cord stump falling off by virtue of using chlorhexidine. Remember, we said that some of the reasons they use other forms of things on the cord is because they want the cord to stop to fall off quickly. That is where communication comes in. Communication strategies, messages, and materials to mothers and carers should let them know that there might be a slight delay in applying the gel, but one sure thing is that it will prevent infections, whereas the other materials that they use, the other local traditional materials, would predispose the baby to having newborn infections and possibly even death. So, in conclusion, many newborn babies develop infections at home and die as a result. It is important to continue to care for mothers and newborn when they go home, and to support mothers and community members to prevent newborn infections. So there's a practical session that you have to engage in now that we have finished this lecture. You are to pair up with a class member and role play the care of a newborn during a postnatal visit to a mother at home. You also have your assignment for this unit to complete. Thank you very much for your time.